Hi, everyone, and welcome to Squawking with Siegel, a fitness talk show for college students hosted by a college student. I'm your host, Nick Siegel, otherwise known as Siegel Strength. If you're interested in more great fitness related content, make sure you check out my website at www.siegelstrength.com or my Instagram at Siegel_strength. Today is the mindset segment, and I'm lucky enough to get the opportunity to sit down with Dr. Stephanie Goldstein, licensed clinical psychologist and an expert in weight loss management. Throughout her career, Dr. Goldstein has worked with patients with eating disorders, such as anorexia and binge eating, as well as helping patients lose weight through behavioral weight loss, otherwise known as BWL. Dr. Goldstein has a huge wealth of knowledge when it comes to mindset and the psychology involved in both eating and weight loss. So I'm sure you guys will be able to learn something today that you can implement in your everyday fitness journey, as well as learn more about the field of clinical psychology and weight loss management. Dr. Goldstein, first off, thank you so much for taking time out of your busy day to sit down with me and have this conversation.
Of course. Thanks for inviting me.
Um, would you like would you like to start off by telling us a little bit about your professional journey and how you became a clinical psychologist and expert in weight loss management?
Yeah, it was a long journey for sure. But it was fairly straightforward because I knew I wanted to be a psychologist ever since high school. I started out right away getting my bachelor's degree in psychology from Drexel University in Philadelphia. And during that time, I was really passionate and became heavily involved in clinical research. And for those of you who aren't sure what that is, it just basically involves, very simply put, developing and testing out different psychological and behavioral treatments for patients with mental health or behavioral health problems. So I actually continued my education at Drexel University in their doctoral program. So I was there for 10 years. It was a long time. Um, and I actually, in their doctoral program, I earned my master's and my PhD. And as a part of my training in clinical psychology, which is different than some other research degrees, I actually worked directly with patients across many different clinical settings. A lot of them, some of the placements that I had were in Drexel's Eating and Weight Loss Treatment and Assessment Clinic. I've worked at the Veterans Affairs Medical Center in Philly, the Renfrew Center for Eating Disorders, and Cooper University Hospital, which is in Camden, New Jersey. And during that whole entire time, I also provided behavioral weight loss to participants in group settings as a part of ongoing research studies that I was involved with. So that's how I got a lot of the expertise that I'll be talking to you about today. And as you can tell, my training really focused on getting a broad knowledge of behavioral health because nothing sits in a vacuum, while also honing my specialty of eating and weight disorders, which is what I became really passionate about. And since I graduated with my PhD in clinical psychology, which is pretty crazy to think about still, I've become a licensed psychologist and I'm licensed to practice in the state of Rhode Island. And now I really focus primarily on working with individuals who want to lose weight.
Awesome. So with that, then, what exactly is this behavioral weight loss? Can you tell us a little bit more about that?
Yeah, I wish I could say it was a magic bullet, but it's not. Behavioral weight loss is an approach to losing weight that we use that in research lingo, we refer to that as gold standard. So that means it's been tested in many different research studies over and over and over again and found to be effective on average for most people trying to lose weight. When we think about things like empirically supported treatment and evidence-based treatment, that's really what we're going for, is we want these treatments that have been tested over and over again. And behavioral weight loss can look a little different depending on who is providing it and how, but I'll give you the basic overview. It primarily has the same elements every time, which usually consist of a calorie goal, a physical activity goal, typically involving aerobic exercise like cardio, but also depending on your goals, incorporating strength training, daily self-monitoring of your calories, physical activity, and weight. So if you think about like apps like MyFitnessPal or Lose It or Noom or things like that, those all help you with self-monitoring your food and your activity and your weight. Usually, if you're a part of a great behavioral weight loss program, you get feedback on those things from a trusted counselor. And then you spend a lot of time learning different cognitive and behavioral skills that make sure you meet those goals. So for example, modifying your environment, trying to plan your meals, dealing with unhelpful thoughts that might come up during weight loss. All of those things are important successful ingredients for trying to lose weight and to maintain your health. And the result of that is that we expect a slow and gradual weight loss of 1 to 2 pounds a week so that you can keep sustaining these healthy changes over a long period of time. So this doesn't look like a crash diet or intermittent fasting, or I don't like name a diet that has come up. This looks like very slow, very gradual, and we want this to be like something you do in the long term.
So it's more like lifestyle changes to help you continuously eat healthier.
Totally, exactly.
Sounds awesome. And obviously, you bring the psychological aspect to this BWL program. Um,
Mhm.
but I assume there's other professions that you work with. So what type of other professions and people do you work with, and how many people are really involved in these programs for BWL?
Yeah, I think it depends. So the type of behavioral weight loss program I typically use is standard, meaning that, like I said, the basics of it kind of look the same for everybody. And the reason why they look the same is because these basics were developed by a large team of researchers from all of these different fields and professions, like you say, of nutrition, exercise physiology, psychology. Those are just like some of them. These groups are made of huge disparate fields. But every person is different. So like you said, what I typically do is I personalize and adjust the program based on someone's needs and their readiness for change. And one of the ways I do that is where I can, I refer the patient to specialists as needed. So sometimes that involves working in tandem with dietitians, which I do, for example, when someone's health status is really complicated or where they have a lot of nutritional needs that aren't like standard or what we call normal. Physical therapists, trainers, even other psychologists, because sometimes like we only have 30 minutes to talk about your weight today, and if there's other things going on, you might need another provider to talk about that. It's okay to have more than one. I work with primary care physicians, cardiologists, endocrinologists. I kind of just do the whole thing. So the treatment teams are, yeah, so the treatment teams are as big as they need to be. And I usually really focus on trying to coordinate treatment as best I can, because that is not a lot of people are able to do that. Some people have many doctors who don't talk to each other, so that can be difficult. So it doesn't usually get that big. I typically work with one or two other specialists as patients really need it.
Okay, awesome. That all sounds very cool.
It is very cool. I like it.
So last time we spoke privately, and you were telling me kind of about your work with acceptance-based treatments for weight loss, and I found that super interesting. So I was hoping today you could tell me more about that and tell our viewers about what acceptance-based treatment is.
Yeah, it's a big ask, but I'll keep it brief. So acceptance-based therapy, behavior therapy for weight loss, is a new approach to healthy eating and activity that really focuses a little bit more on the mental game of weight loss. I'm sure if any of you have tried to be healthy or to change your behavior at all, changing your behavior is as much a mental game as it is a physical one. So in brief, the premise basically centers on the principle of acceptance. And in this world, acceptance means specifically a willingness to be open to all experiences that life has to offer, including the unpleasant ones, which can be a difficult pill for some of us to swallow because we don't like having to deal with unpleasant things. And we actually find that people spend a ton of time trying to control their unpleasant experiences. And when that happens, it can actually backfire. So I'll take weight loss as an example. Weight loss, or even just, let's say, trying to make healthy and eating and exercise changes. Let's just say you're trying to change your eating behavior. It can have a lot of unpleasant experiences that go along with it. It's what makes it hard, right? An example of one of those unpleasant experiences is cravings. It happens a lot where people are like, I want this food, and I'm uncomfortable, like in an uncomfortable way.
Yeah.
And we hate them. We hate cravings. And then sometimes we can even hate on ourselves for having them. But think about it. From this acceptance-based perspective, we think, okay, we're hardwired from our evolution to seek out foods, and we're hardwired to be sedentary. So think back to like when we were cavemen and hunting our food to survive. So this is a powerful and long-standing tendency that hasn't changed with the times. We like haven't seemed to evolve past it, which is a bummer. I'm waiting for it any day.
So
So
we're
can you
evolved to crave like those fatty and sugary foods?
Yeah. Because if you think about it, like we didn't know when our next meal was going to be. We, were mostly hunting and gather or hunting meat, which has like a ton of fat and a ton of, protein and all that good stuff. So, our brain is really hardwired to seek out those things.
Huh.
And because of that, you can't really control that tendency. And a craving can just rear its ugly head sort of whenever it wants. Sometimes it makes sense, but sometimes it doesn't. But does having that craving mean that you're doomed to never lose weight or doomed to be unhealthy forever? No, it also just happens. So in our acceptance-based approach, we don't say, oh, we'll just accept that you're gonna have a craving and like be uncomfortable forever. But we more just say, don't spend time trying to fight that craving. Don't spend time judging yourself for having it. If we let these uncomfortable thoughts or feelings like cravings, feeling unmotivated, wanting to sit on the couch instead of exercise, if you let those things just be there by making room for them, not trying to change them, just sort of acknowledging that they're there, and instead focus your efforts on what you can control. And what you can control is your behavior. So we really focus on trying to help people distinguish what they can control from what they can't control. And we also spend time reminding you, for example, of your why. So why do you want to be healthier? Why is it worth it to experience and tolerate this craving right now? So we're not just asking you to experience discomfort for the sake of discomfort. You're experiencing it for a reason. And that reason is something that you've identified as something that's important to you. Not me, not your doctor. You want to do it. So that's how we work things in for you to make healthy changes in a way that's healthy for your body and your mind.
That's so interesting. And I guess I read some of your studies about that, but overall, you guys have found that that's a more successful path at weight loss than.
So far, yeah. So there's a lot of people doing research in this area, and like I said, right, when you really want to trust something, you want it to be tested again and again and again. There's studies that the group that I used to be affiliated with at Drexel have done that have shown that it's a better approach, and that for people it helps them keep weight off longer. Mostly tested in adults who are in the more like middle age range, but still. And other groups have shown that not only does it help with your weight, but it also helps with like a lot of other parts of the mental game of weight loss too. So even though it might be equivalent to the standard behavioral weight loss approach, it helps you in so many other ways too. So basically, like there's no harm in taking this approach if it's something that really jives with you.
Well, right then at the end when you were talking about remembering your why, that kind
Mm-hmm.
of thought me of like all the things you like, all the signs you always see in the gym. That's like remember why you started and stuff like that. So like
Mm-hmm.
the pain you're going through with your cravings or at the gym working out, and you might be tired. You want to remember why you're going through these negative
Mm-hmm.
feelings in order to reach your goals.
Totally. That's a really good gym that you're going to. I like that.
Um, but now I like to talk about how, unfortunately, in college and also starting this social media account, I'm seeing more and more people forming negative relationships around food. And I think it probably stems a lot from social media and society as a whole, causing body insecurity issues. And I just wanted to ask you, based on your work with research done with patients who form eating disorders, such as anorexia or bulimia, what kind of advice would you give to someone who's maybe beginning to formulate these negative relationships with food?
Yeah, this is so tough. And it's tough to, be in a position where you're seeing a lot of that firsthand. College is definitely a time where we find that people are often, developing difficult relationships with food, and also with their bodies. But sadly, research actually shows that some of this starts from a very young age, like so impossible sometimes to wrap my head around, like toddlers starting to notice that their bodies are different or like undesirable in a particular way, which is sad. So although social media is a huge culprit, as you point out, for sure, our society as a whole is problematic, and someone can learn or develop these negative relationships with food from all sorts of places, from their families, from their friends, from their media consumption. And I think my biggest piece of advice would be, first of all, that this is very general, because the problem itself, while it's easy to name, it looks so different for everybody. So everybody's sort of fighting their own individual battle with it. But if you do start to notice negative thoughts surrounding your food, your body, your exercise habits, and especially if these are already starting to impact your behaviors, sometimes it might be so subtle that you might not notice it. But like, for example, if you're feeling uncomfortable at restaurants with your friends, or you're constantly checking your body in the mirror for fat or for muscle, or you feel so guilty when you skip exercise, those are a few like early signs that I think some people think are normal, but they might be indicative of like starting to develop some of these negative relationships. If you notice them, start talking to someone. You can talk to a psychologist, a dietitian, a social worker. You don't have to have an eating disorder to get your head right about how you approach your health. I think that's the problem sometimes with society and mental health these days, is that a lot of people are like, oh, my problems don't qualify for that issue. But talking to someone, you can talk to someone for any reason, just because you want to, just because you want to be healthier and be better. So you can go to your counseling center or local clinic or talk to your parents about it. But just, you know, starting to talk about it now makes it that much easier. You're in a great place. If you're a college student watching this, you're in a great place to break your patterns and learn new, healthier thoughts and health behaviors. So that would be my biggest piece of advice. And as far as like the right now, you can start that work just by, even like you said, Nick, with the social media stuff, you can start by consuming body positive media. So we're actually fortunate, I think, to be in a time where a ton of you are taking up arms to combat this like thin ideal that society used to have, sort of in my generation. Not to date myself or anything, but I'll recognize the difference. I'm not a college student anymore, I can say that. But you guys are all like sort of starting the revolution. So you could be a part of that revolution by either consuming body positive content, posting about it, or even gently calling out others if you feel comfortable who are posting negative content. And one of the things that I think, not to do a shameless plug for this blog, but I think this blog is an excellent example of generating that content where it's health focused, it's body positive, it's bringing information to people who need it. And so I would say take note that this is a great start.
Awesome. Thank you so much.
Yeah.
And I guess under the next question, kind of what are some daily lifestyle changes that a person who's watching this could kind of start implementing in their daily life in order to fit their fitness goals, whether that be eating healthier or getting to the gym and just being active more?
Totally. There's a ton of things that people can always do to be healthy. Eating and exercise, I think, I'm biased because I'm a person who helps people with their eating and exercise, but they're the two really important behaviors that have so much impact on your health later down the line. So I would say, exactly what eating plan or exercise plan you should start might depend on your goals. I think, Nick, you do a really good job of like sort of illustrating that there's many different types of fitness goals that one could have. But I'll talk to my experience with weight loss in particular. The most impactful thing someone can do to lose weight is to change their eating, usually, especially in the short term. So in my work, granted it's with older adults, but I think this goes well for college kids too, is switching to the Mediterranean diet or something like it, which is easy to follow because it focuses on whole foods like fruits, vegetables, lean proteins, beans, whole grains, making sure you're incorporating healthy fat in your diet. So fat is not bad, just we want you to do healthy fat. So that's like olive oil instead of butter. And reducing processed foods, which I think is probably the hardest one for all of us because they're so tasty all the time. But the diet, what I like about it is that it's flexible, it's easy to follow, and it doesn't have off limits foods, which I think, creates problems with people when they start to feel like they can't eat things that they like or that they want. So those would be like the first steps at dietary changes. And if you want to exercise, but you're not sure where to start or you haven't in a while, I'm constantly reminding people to just walk. Like walking is good for you, but we discount it sometimes because, if we're not covered in sweat by the end of the day, then it's like not worth it. Or like if I didn't go to my exercise class for an hour, then I might as well skip. So remember that, especially during the pandemic, you might be finding yourself being more sedentary than usual. Start with a daily routine of a 10 to 20-minute walk or jog if you're up for it. And then just add 5 minutes to that goal every other week. The goal would be for you to get to about 150 to 300 minutes of cardio per week, which you can meet if you spread it out through every day. And then my last recommendation would be, if you really want to commit to some of these changes, this might be a different approach for some people. You could try tracking. So you try tracking your eating and exercise in an app. Science basically says that that's the best behavior change tool because you can gain insight into what you're doing, and what you're doing really well, and to what might be getting in the way for you. So it's one option, but it might not be for everybody. So it's always something you could try, and then you don't have to keep doing it if you don't want to.
Yeah, I really like the tracking. I think you mentioned before, the MyFitnessPal app
Mhm.
that Under Armour has. And I thought that was so cool when I first started doing it. And you kind of just realize exactly what you're eating every day. Because before I started tracking, I would just eat whatever. Um,
Yeah.
Once you actually start looking at it, you learn a lot and you be like, oh, why did I feel so sluggish and tired today? And then you see all the bad foods, all the processed crap you ate, and you're kind of like, oh.
Right. And what I always tell people is that I think that's empowering, because I think it could be frustrating to have that feeling of, I don't know why I feel so tired and crappy. But then you're like, oh, I do know why I feel so tired and crappy. That's something I can change. So having that knowledge really sets you on a path and sets you up for switching things up if you want.
I think that's great advice. And the MyFitnessPal app's free on the App Store. So
Go for it. You could also do it on Fitbit. I think Lose It might be free too. There's all sorts of ones.
now I wanted to ask you, what's something that you've learned from working with your patients at your work?
It's definitely hard to keep it to one thing because, you listen to people a lot and you learn a lot, right? But I've learned, I think the biggest thing that I'd like to share with everyone for this is that I've learned that weight loss is simple but not easy. So in our society, being healthy isn't the easy choice, right? And prioritizing your health is sort of like a vow that people just renew again and again and again and again. And that's the case regardless of the number on the scale. So sometimes people who are of a certain weight status or who feel like they're overweight or who are unsatisfied with their weight will sort of project onto people with different weights than them or of a lower weight that like their lives are different and they don't have to care about their food intake. But like everybody does, because your food is not quite about your weight. It's more about your health than anything else. And it's okay. It has to be okay for us to pick up that vow, pick up that like priority of health and put it down again as life permits. So like you'll go through periods of your life where things are just crazy and you're going to eat like crazy. And then, you'll be like, wait a minute,
Pandemic.
like now. It's like that meme of like, I'm tired of living through major life events. Like it's, so you have to be able to pick it up and put it down. Otherwise, like if you expect yourself to be perfect, you're gonna drive yourself crazy, and that's not what this is about. And this rarely occurs in a vacuum. So sometimes we think like, I'm gonna change my weight and that's gonna change everything about my mindset and how I think about myself and what I can do with my life. There's a lot of like tiny little insidious thoughts like that can happen. But there's a ton of people who show up for weight loss treatment with me who have depression, anxiety, body image issues, relationship issues. No one ever just comes to lose weight. There's like always something else going on, or it's really rare that there's not something else going on. So losing weight is good for your health, but you still got to work on the whole picture. It doesn't resolve everything just like that. So I think that's something that's really important to take away, is that we can easily get caught in that thinking trap.
Interesting. Um, and I guess a fun question more of is, what would
Yeah,
you
bring it
say,
out of the
what would you say is your favorite part of your job?
Well, it's got its ups and downs. I love every single part of my job. I don't regret being a clinical psychologist for a second. It was a lot of work, but I love that I could all the things I can do with it. So while I'm licensed to practice, I actually spend most of my time at my profession conducting clinical research, as I mentioned before. So my favorite part of that and why I love doing it, and thanks for asking this question because I think sometimes you get in the day to day, and I was like, oh yeah, I really do love my job. My favorite part is like just coming up with new and creative ways to help people and meet them where they're at. So I typically use different types of cutting edge technologies like smartphones, wearables, artificial intelligence, and things like that to enhance or optimize the way behavioral weight loss has worked for decades. So my goal is to kind of bring this into the current century and bring it to the future really. And then I get to sort of create projects and get funding that helps me systematically test those new tools and treatments. So I can feel confident that I've made something that'll work relatively well for most people. So it sort of blends like my love of treatment with like my love of science, and I sort of get to put it all together, and it's very cool,
That's
in my
awesome. Yeah,
opinion.
very cool. Um, well, that sounds awesome. And if someone's listening to this and they're interested in doing a similar profession as you, or just the field of clinical psychology and weight loss management in general, what kind of advice can you give to someone who might be interested in all this?
Yeah. So, as you've probably gathered, hopefully, by the conversation today, there's a lot of different ways to have a career in helping people make health behavior change. And I think my biggest piece of advice is to get out there and talk to people who do this work. Um, Health and weight loss doesn't happen in a silo. The development of treatments for it don't. The administration of treatments for it don't. It has many different disciplines that work together to advance the field and provide care to people who need it. And you're not going to be the person who does all of that. There's just no time in the day. So you're going to be most useful if you find ways to bridge or intersect those disciplines. Like, for example, be a practicing dietitian who's also involved in research studies that they're passionate about. Be a clinical psychologist who collaborates with exercise physiologists or engineers to, try to advance the field. The best way to do this is to really just listen and learn from others and keep your mind open is my biggest piece of advice. You're at a really awesome phase right now where you get to keep your mind open. And when you get in this health related field, you never stop learning. You don't just be like, check, I'm a dietitian, and then you don't have to like consume new research or media or anything like that. So I personally love that about this work, that I'm not staying still at all. But I think it's something to keep in mind for those who are interested in it.
Awesome. Um, well, thank you
Yeah.
so much for such an interesting and informative presentation today. I love hearing about all the great work you're doing, and it's always so nice talking to you. So thank you. And I also
Yeah, of course.
never really realized how much psychology and mindset truly plays into weight loss and fitness in general. So it's so interesting getting like a psychological side of it all.
It is. I always joke around with people because they are always like, wait, why am I sitting down with a psychologist when they sit down in my office at first?
Well, if people watching, if the viewers watching today want to kind of learn more about what we've talked about today and just read more about it, do you have any recommended readings or resources that they could go to?
I mean, there's a ton, right? But I think I will recommend some of my favorite books on some of these topics, just because I'm not going to spit you guys like treatment manuals and, scientific articles. But if you want them, I can give them to Nick for you. Because I'm such a nerd. Okay, so the first one that I wanted to recommend that I read a couple of years ago is called Hunger by Roxane Gay. She's a fantastic writer. You could read that memoir or any of her other books. But she really talks about her journey with her weight and her eating and how that's impacted her. I'll warn you that it's a powerful read, but I really enjoyed it. And then if you'd like to learn more about the acceptance-based weight loss stuff, I would recommend The Diet Trap by Jason Lillis. It's a book about the rationale behind why should use acceptance when we think about dieting and how that can move us forward. And then the last thing I'll recommend is a book by Susan Nolan Hoxema called Eating, Drinking, and Overthinking. That's a book that kind of talks about the intersection of your mindset and how that plays into your eating and drinking behavior. It also covers things about like alcohol and depression too, which might be relevant. Regardless if it's relevant for you, it'll still be interesting to think about how all these things intersect. So I think those would be some places to start.
Awesome. That sounds interesting. I'll have to look into those myself.
Yeah. Let me know what you think.
Yeah, I will. But thank you again so much. And thank you to our viewers for tuning in and watching the fourth and final episode of Squawking with Siegel. I truly hope you guys have enjoyed these and maybe even learned a thing or two, hopefully. But I will be returning next week to the written blog posts, so make sure you check those out at www.siegelstrength.com, or you can go to @Siegel_strength on my Instagram to make sure you don't miss out on those. And you can also sign up for email alerts on my website to really ensure you don't miss out on anything. But thanks everyone and happy thinking.
Thanks everyone.